Josh Morrison joins us now from New York. Hi, Josh. First, justify this experiment and why it would actually be worth it. How much could it really speed up the development of a vaccine?
So we think that, even if it saves just one day, it could be really valuable. We think that it could actually save a month or even more in vaccine development. And that's basically because in a usual clinical trial, you would be having about 5,000 people over the course of maybe 6 months or more, whereas this can be done with about 100 people in maybe a couple months.
Okay, I mean, you are the founder. You're still trying to get government approval to begin this experiment. It's something you have to do no matter how many thousands of volunteers you may have. Do you expect to get the approval given the risks?
So we think there's been a lot of encouraging signs in our conversations with the World Health Organization and with the National Institute of Health that more and more the leading medical institutions and ethicists are open to this kind of idea and interested in pursuing this kind of idea. There's a number of different entities that would have to say yes. For example, the Institutional Review Board, or what's called an IRB, at the university or institution conducting the study would need to approve it. But I think we're seeing very positive indications that experts in the field think this could be quite a useful option, and that preparations need to begin as soon as possible to make this a reality and make it available if it's going to turn out to be useful.
Okay. Josh, I have to ask you this. I mean, what will happen if you do go forward with this experiment, and people potentially die from either COVID-19 or from the vaccine itself just misfiring?
Of course. So obviously, that would be tragic. Just like people dying in war is absolutely tragic. And that's something that we would all feel devastated about. But at the same time, that doesn't mean that it's not worthwhile or that their sacrifices would be in vain. And I think that, thinking about deaths during war and that type of national service, or people who are, police officers or firefighters, is the right comparison here, where there are risks there, and unfortunately, sometimes people tragically die. But the benefits here to humanity could be absolutely enormous and could justify taking these risks.
Okay, you say the benefit would be absolutely enormous, but you're talking about, you said, saving 1 month in the development of a vaccine?
Mm-hmm. And so, yeah, I think that's a realistic goal. And if we think about, even let's say that a year from now or 2 years from now when a vaccine's deployed, let's say that we're in a good situation and, coronavirus is only killing as many people as flu. I think all of us would be pretty happy if that's where we were, but flu still kills about 1,000 people per day. So just a month sooner for that would be 30,000 lives being saved, which is enormous. But the reality is that we expect coronavirus, unfortunately, to be much more significant than that. And I think just looking around the world now and the tremendous devastation that coronavirus has wreaked, both in terms of lives directly, but also other types of medical treatment people aren't pursuing, I think a month less of what's going on right now would be incredibly important and is worth quite a bit of effort and sacrifice to try to achieve. And it's certainly worth that to me and that I would be willing to take on those risks if I could be some small part of saving that time and bringing the world back to normal, a day sooner, a week sooner, a month sooner.
Josh Morrison, you make a good case. Thanks so much for joining us there from New York. We appreciate it.